I know drugs when I see them, my stepfather Gerald announced with the righteous satisfaction of a man who believed he just saved his family from destruction. Unmarked bottles, pills in strange colors, locked in your old bedroom like some kind of pharmacy. I did what any good parent would do. My mother nodded supportively beside him, her face arranged in that expression of concerned disappointment she perfected over my 32 years of apparently failing to meet expectations. But why did my blood run cold at his words, and why did the phone call I made immediately after, to the chief scientific officer of Meridian Pharmaceuticals, trigger a federal investigation, 3 lawsuits, and the destruction of everything Gerald thought he was protecting? Gerald, I need you to tell me exactly what you flushed. Every single pill. Don't take that tone with me, Natalie. Those pills are gone. Whatever trouble you were getting into, it's over now. Those pills were experimental cancer treatment compounds. They were worth $2.1 million. And you just flushed 18 months of clinical research down your toilet. The color drained from his face. That's impossible. They were in unmarked bottles. They were in specialized containment because they're not yet FDA approved. I'm a pharmaceutical researcher. I was storing overflow samples from our laboratory while our facility underwent renovation. I pulled out my phone. I need to call my company. And then I need to call our lawyers. And then the FDA is probably going to call you. My mother's supportive expression crumbled into confusion. Natalie, surely you're exaggerating. Mom, Gerald just destroyed proprietary compounds that represent 18 months of work, millions in investment, and the hopes of cancer patients waiting for this treatment to reach trials. I'm not exaggerating anything. I'd been a pharmaceutical researcher for 9 years. My specialty was oncology, developing compounds that could target cancer cells with precision while minimizing damage to healthy tissue. It wasn't glamorous work. Long hours in laboratories, endless documentation, failures that outnumbered successes by orders of magnitude. But occasionally, something worked. Something showed promise. Something made it through the gauntlet of testing and approval to actually help people. The compounds Gerald flushed were my life's work. Project Aurora had been in development for 3 years. We desynthesized a molecule that showed remarkable efficacy against treatment-resistant breast cancer, the kind that laughed at conventional chemotherapy and radiation. Early trials had been promising enough that Meridian Pharmaceuticals had invested heavily in advancing the research. The samples in my childhood bedroom represented our entire remaining supply of the refined compound. Our primary storage facility had experienced a climate control failure during renovation. Rather than risk degradation of irreplaceable materials, I volunteered to store the samples temporarily in a secure location, my old bedroom at my mother's house, which still had the mini fridge and temperature controls from my college days when I stored laboratory materials during breaks. I'd explained this to my mother. I'd told her the samples were valuable, sensitive, and not to be touched. I'd locked the bedroom door and given her the only key. What I hadn't anticipated was Gerald's heroic intervention. Gerald and I had never gotten along. He'd married my mother 6 years ago, stepping into a family he didn't understand and immediately trying to reshape it according to his vision. He was a retired plant manager, a man who believed in hierarchy, order, and the rightness of his own judgment. He'd spent 40 years telling factory workers what to do. He saw no reason to change his approach with his new stepdaughter. "You work too much," he'd announced at our first family dinner. "A woman your age should be focused on finding a husband, not playing scientist." I'm not playing scientist. I have a PhD in biochemistry. Book learning isn't the same as real work. I built things for 40 years. What have you built? Cancer treatments that might save thousands of lives. He'd snorted dismissively. Might. That's the problem with you academic types. Always, might, and possibly, and potentially. In the real world, results matter. We'd maintained a cold détente ever since. I visited rarely, spoke to him less, and tolerated his presence for my mother's sake. The samples had been at the house for 6 weeks. I'd visited twice to check on them, verify temperatures, document chain of custody. Everything had been perfect. Then Gerald decided to help. The phone call to Meridian's chief scientific officer was the worst of my career. "Dr. Okafor, I need to report a loss of materials. The Aurora samples stored at the secondary location have been destroyed." Silence. "Then, all of them?" "All of them. My stepfather found them, assumed they were recreational drugs, and flushed them. That's 18 months of synthesis. We don't have backup cultures mature enough to produce more for at least 8 months." "I know. The phase 2 trials were scheduled to begin in 6 weeks." "I know. Natalie, this is a catastrophe. We have patients enrolled. We have FDA timelines. We have investors expecting progress reports." "I know. I'm so sorry." "This isn't about sorry. This is about chain of custody, about security protocols, about..." He paused. We're going to need to involve legal and regulatory and probably law enforcement. I understand. Your stepfather, he needs to understand this isn't a family matter anymore. He destroyed federally tracked research materials. There will be consequences. The FBI arrived at Gerald's house 3 days later. I wasn't present for the interview, but I received a full report from Meridian's legal team. Gerald had apparently maintained his righteous stance for approximately 15 minutes before the magnitude of his actions began penetrating his certainty. Mr. Morrison, you disposed of materials that were part of an FDA-regulated clinical trial. The compounds were tracked, documented, and represented millions of dollars in research investment. This isn't about a family disagreement, this is about federal regulations governing pharmaceutical research. Gerald's response, according to the report, they looked like drugs. Anyone would have thought they were drugs. They were drugs, sir. Cancer drugs. Experimental cancer drugs that might have saved lives. And you destroyed them without any attempt to verify what they actually were. She should have told me. According to your wife's statement, Dr. Okafor did tell her. Multiple times. Your wife gave you this information before you accessed the locked bedroom. The investigation continued for 3 weeks. Gerald was not charged criminally. The legal team determined that prosecution would be complicated by the family relationship and the lack of malicious intent, but he received a formal warning from the FDA and was named in Meridian's civil lawsuit seeking damages. The lawsuit was for $4.3 million, $2.1 million for the destroyed compounds themselves, plus $2.2 million for delays, patient harm, investor losses, and regulatory complications. Gerald's home equity and retirement savings combined didn't come close to covering it. The family confrontation happened at my mother's request. Please, Natalie. Come talk to us. Gerald didn't mean any harm, he was trying to protect the family. Protect the family from what? From cancer research? He didn't know. He didn't want to know. He assumed, judged, and acted without asking a single question. That's not protection. That's arrogance. I went anyway. Not for Gerald, but for my mother, who was caught between a husband she'd chosen and a daughter she'd raised. Gerald sat in his recliner, looking smaller than I'd ever seen him. The confident patriarch who'd lectured me about real work was gone, replaced by a man facing consequences he'd never imagined. I want you to understand something, I said before he could speak. Those compounds weren't mine. They belonged to Meridian Pharmaceuticals, to the investors who funded our research, and to the cancer patients who were waiting for treatment. You didn't flush my suspicious pills. You flushed hope for people who are dying. I didn't know. You didn't ask. My mother knew what was in that room. She told you. You decided you knew better, that your judgment about what drugs looked like trumped actual information. They were in unmarked bottles. They were in laboratory containment vessels, clearly labeled with chemical identification codes. You didn't recognize them because you've never seen research materials before. But instead of pausing for 5 seconds to consider that you might not know everything, you destroyed 18 months of work. My mother tried to intervene. Natalie, he was genuinely concerned. He was genuinely arrogant. There's a difference. Concern asks questions. Arrogance assumes answers. The aftermath devastated Gerald's finances. The lawsuit settled for $1.8 million, less than the original demand, but still catastrophic. Gerald had to sell the house, liquidate his retirement accounts, and would be paying damages for the rest of his life. My mother called me crying. We're going to lose everything. The house, the savings, everything we planned for retirement. I'm sorry, Mom. I really am. But Gerald made choices that had consequences. Can't you do something? Ask your company to reduce the settlement? I already did. The original demand was $4.3 million. They reduced it because I advocated for leniency. But Meridian has investors, obligations, patients who are counting on this treatment. They can't just absorb millions in losses because my stepfather couldn't be bothered to ask before acting. He's my husband. And I'm your daughter. The daughter whose career he nearly destroyed, whose life's work he flushed down a toilet while congratulating himself on his good parenting. I took a breath. I love you, Mom. But I can't fix this. Gerald has to live with what he did. The research delay was even more painful than the financial consequences. 8 months. That's how long it took to cultivate new cultures, synthesize new compounds, and return to where we'd been before Gerald's intervention. 8 months during which patients enrolled in our trial had to find other options, or had no options at all. 3 of them died during the delay. I knew their names. I'd reviewed their files when they enrolled, understood their histories, their hopes, their reasons for joining an experimental trial. They'd trusted us to move forward with urgency. Gerald's protection had killed them as surely as their cancer. I didn't tell him that directly. Some truths are too heavy to use as weapons, even against people who deserve to feel their weight. But I knew, and that knowledge changed something fundamental in how I saw him. He wasn't just an arrogant man who'd cost his family their savings. He was a man whose certainty had cost 3 people their lives. Gerald reached out to me a year after the settlement. I was surprised to see his number. We hadn't spoken since the family confrontation. My mother served as our sole connection, passing updates neither of us requested. Natalie. I need to say something. I'm listening. I've been doing research. About Project Aurora. About what those compounds were supposed to do. His voice was rough. I read about the patients in your trial. The ones who didn't make it. What do you want me to say, Gerald? I don't want you to say anything. I want to say that I understand now. What I destroyed wasn't pills and bottles. It was someone's chance. Multiple someones. Yes. I thought I was doing the right thing. I thought I was protecting your mother from having a drug addict stepdaughter. I thought I was strong, decisive, acting when others would hesitate. He paused. I was wrong. About the pills, about you, about everything. I know. Can you forgive me? I considered the question carefully. Forgiveness was complicated. Gerald's actions had cost millions of dollars, delayed critical research, and contributed to 3 deaths. His arrogance had been breathtaking, his assumptions insulting, his refusal to ask questions unforgivable. But he was also a man who genuinely believed he was helping. Who'd applied 40 years of factory floor certainty to a situation that required humility he didn't possess. Who was now living with consequences that would follow him to his grave. I can forgive the intentions, I said finally. But I can't undo the results. 3 people died during our delay. Their families won't get apologies or settlements. They'll just have empty chairs at dinner tables. I know. I think about them every day. Good. You should. Natalie. I don't hate you, Gerald. But I also can't pretend that what you did was just a mistake. It was a catastrophe born from arrogance. You decided you knew better than everyone, me, my mother, the labels on the containers, basic logic that says you should ask questions before destroying things you don't understand. You're right. I know I am. And now you know it too. That's the only progress available to us. Project Aurora resumed trials 8 months after Gerald's destruction. The new Phase 2 results were remarkable, even better than we'd hoped. The compound showed efficacy rates that made hardened oncologists weep. We fast-tracked through Phase 3 with FDA support, and 2 years later, Aurora received approval for treatment-resistant breast cancer. The lives we've saved since then number in the thousands. I think about those 3 patients who died during the delay. Their names are etched in my memory: Patricia Okonkwo, Diane Fitzgerald, Margaret Chen. They trusted us, and we failed them, not through scientific inadequacy, but through the actions of a man who couldn't imagine being wrong. Gerald wasn't at the FDA approval celebration. He wasn't at the press conference where we announced results. He exists now in the margins of my life, a cautionary tale about certainty and consequences. My mother stayed with him. I understand her choice, even if I struggle with it. Marriage means accepting your partner's failures, even catastrophic ones. She visits me separately now, and we don't discuss Gerald unless necessary. The pharmaceutical industry changed its protocols after our incident. The Morrison case, they called it in regulatory meetings, a cautionary example about chain of custody, about secondary storage locations, about the vulnerability of research materials to well-meaning interference. I've given lectures about it, spoken at conferences, written papers about protecting research integrity against unexpected threats. We prepare for contamination, equipment failure, natural disasters, I tell audiences. We don't always prepare for human certainty. For the stepfather who knows drugs when he sees them. For the administrator who dismisses protocols as bureaucratic. For anyone who decides their judgment supersedes established procedures. Gerald became famous in pharmaceutical circles, though not by name. He's an archetype now, the certain man. The one who acts without asking, destroys without understanding, and stands righteous in the ruins of someone else's work. My daughter asked me about him last week. She's 8 now, curious about family dynamics, trying to understand why we visit grandma alone while someone named Gerald exists only in oblique references. What did he do that was so bad? He destroyed something important. Something that could have helped sick people get better. Why? Because he thought he knew what it was without asking anyone. He was so sure he was right that he didn't bother to check. That's dumb. It's human. People do it all the time, decide they understand things without really looking. The problem is when being wrong costs more than embarrassment. What did it cost him? His house. His savings. His relationship with me. I paused. And 3 people didn't get medicine in time because of what he did. Did they die? Yes. She was quiet for a long moment, processing information too heavy for her years but important enough to share. Mom, I promise I'll always ask questions before I do stuff. That's all anyone can ask, sweetheart. That's all anyone can do. Gerald Morrison destroyed $2.1 million in cancer research because he knew drugs when he saw them, he was certain. He was wrong. And people died because of it. The pharmaceutical industry learned from his mistake. Protocols changed. Security improved. The Morrison case became a teaching example. But Patricia, Diane, and Margaret don't care about teaching examples. They died waiting for treatment that arrived 8 months too late, 8 months that existed only because one man's certainty exceeded his humility. I still work in cancer research. Project Aurora has evolved into Aurora Plus, targeting additional cancer types with similar mechanisms. We've saved thousands of lives and will save thousands more. But I keep 3 photographs in my office. 3 women who trusted us. 3 names I'll never forget. Gerald learned humility too late for them. I hope others learn it earlier. The pills were worth $2.1 million. The lesson should have been priceless. He saw unmarked bottles and assumed the worst, assumed his judgment was perfect, his certainty justified, his action heroic. He flushed 18 months of cancer research while congratulating himself on protecting the family. But protection requires understanding, and he had none. The compounds are gone. The settlement is paid. The delay cost 3 lives that can't be unleveraged or refinanced. Gerald learned that certainty without knowledge isn't strength, it's destruction wearing a confident face. The toilet that received $2.1 million in cancer research doesn't know the difference. Neither did Gerald, until it was far too late.